Hello and welcome to another Voices from the Field interview. Today I'm really happy to be interviewing Dr. Joan Enabulele, who is a restorative dentist in Nigeria. Welcome, Dr. Joan. So Dr. Joan, please tell us, how did you get into restorative dentistry?
All right, thank you, Helen. Actually, my interest in restorative dentistry came about during my undergraduate studies. Of all the dental sciences I was exposed to, restorative dentistry seemed to be the only one that was so abstract. And then I had this innate feeling that there was a need to know more about restorative dentistry, get in-depth knowledge. And so I decided that after undergraduate studies that I was going to go back for my postgraduate residency training in restorative dentistry, because at the undergraduate level, I barely understood what I was doing. So I would say it's out of the fact that it was a bit difficult. That's what actually prompted me to go into it.
Great, so you obviously aren't scared of a challenge, that sounds like.
Yeah, I'm not scared of a challenge, actually. You know, with challenges, life becomes more interesting. So I'm not the routine kind of person. I'm let me put it this way, that being modest, I'm the extraordinary kind of person.
Oh, I love it. No. And I imagine through the pandemic, there were many challenges that came up. Can you explain what was sort of the biggest challenge for you personally, or you for dentistry?
Yeah, in fact, um, during the COVID pandemic, I was the head of department of restorative dentistry at University of the Institute Hospital. And you know, with the fear and everything that came on board, the first thing was everybody was scared. There was not enough knowledge. Nobody knew how the pandemic was going to go. And knowing that it was from oral discharge, oral and nasal route of transmission, as a dentist, you are worried because all my work is done within the patient's oral cavity. And so we needed time, first and foremost, to understand the situation, okay, the mode of transmission, the signs, the symptoms. So it was new knowledge that was just thrown out. And so as head of my department at that time, we had to scale down on activities. I had to go back to the drawing board to decide how we will protect the staff, at the same time be able to attend to our patients with little or no knowledge. So the first thing we did was scale down completely on care, only saw emergency cases, and then all our seminars and academic interactions went virtual. So that was another new dimension because we had to move a lot of things virtual. We needed the staff, especially the doctors and those that had direct contact with patients, to be able to understand what was going on, to prepare ourselves for restorative treatment during the COVID. So that was a bit challenging at the initial stage because, like you know, in Nigeria, internet access is also a challenge. So we have to find ways, and these virtual platforms were not absolutely free. So somebody has to be responsible for paying subscription and all that. So we found a way around everything, and gradually we had to produce a standard of care, standard of procedures while in the clinic, you know. So there was a lot of change. It wasn't easy, but it was worth it at the end of the day.
Yeah, it sounds like there were lots of challenges to manage, and as especially head of the department, can you explain a little bit more about the environment that you work in, how many staff,
All right.
etc.?
Okay. I work in a tertiary health institution in Nigeria, and we have a dental center. Okay. The dental center actually consists of 6 departments, of which restorative dentistry is one of them. So the restorative dentistry consists of laboratories. We have clinic, like the dental outpatient clinic. Okay, so we have about 11 dental units that we use in the department. And I had at that time, okay, the way the residency training is structured, you have primary residents, that are in restorative dentistry. Then you have those that come to do what we call a posting for a period of time. So they also come to learn one or two things during the duration of their posting. It's part of the residency program in Nigeria. We rotate through certain units and qualify you for different stages of the exam. So at every point in time, we have about 10 resident doctors. We have 5 consultants, restorative dentists in the department, okay? And then our turnout, I would say over a quarter, we get up to 1,000 patients, both new cases and old cases coming into the department, because we have a lot of procedures that we carry out on patients and all that. So you find out that it's, I would say it's a comfortable, when I say comfortable working environment, in that we don't have all that we require, but we're able to make do with what we have to provide care as much as possible, okay? Making sure that our clients are satisfied despite the inadequacies. Sometimes you're working, there's power outage. Sometimes you're working, the units gets bad. You run out of consumables, and there's bureaucracy to be able to get all these things fixed. It's not something you can just fix at the snap of your fingers. So those are the few challenges, because it's a tertiary health institution, so you must go through procedural processes to get anything working. So when you have sudden stoppage, so there are some things that you can't do anything about, but as much as possible, we try to get our clients satisfied, because actually client satisfaction is something that we are keen about. Okay? Sometimes we have patients that are dissatisfied, but as the head of the department at that time, and a consultant in the unit, we are able to get the patients to understand the situation, solve any crisis as they come as much as possible, handle emergencies in very prompt manner so they don't escalate. So that I'll tell you, I have been working as a qualified restorative dentist now for over 10 years. So I tell you that things have gotten better compared to when I came in for residency training about 17 years ago. So I'll tell you, things have gradually become better with regards to manpower, equipment, availability of consumables. It's not as bad as it used to be some years back. So I'll tell you, we are progressing. That's what it's a work in progress.
That's great to hear that things are getting better. And of course, you mentioned how important client satisfaction is. But during the pandemic, with such a big team that you have, how did you and also your institution help support the other dentists and other support people?
Okay, fine. What we we had a schedule of work. So everybody, because we didn't have enough space to accommodate everybody with going by social distancing, so we had to see patients strictly on appointment, and then we had a limited number of patients. We had to triage our patients, and then those that meet the criteria for care would be allowed into the operating clinic. And then the doctors, the staff, we had a schedule. So if you are scheduled to come in, you come in. Otherwise, you stay in, like, we have an office where you can stay. And then when your scheduled patient is around and the client is around, you come in. So we're able to control human traffic as much as possible to ensure adequate social distancing. So it helped. It helped. And then gradually we got used to it, and the number of clients we see a day would increase. And I think we fared well. We fared well. Things have improved much more. I would say safety precautions are still in place till now. There's some safety precautions we introduced that are still in place till now. So it's now become the modus operandi. That's how we now operate. That's how we run. So I will tell you that with the COVID, some things have been introduced and now they become the norm. Mm-hmm. So that's what it is done. So it's also increased the consciousness of safety, whether we want it or not.
I think for everyone, for the public as well, much more conscious of the the safety as well of the health professionals in particular, who have so much contact with so many clients and patients. And during this time, Joan, was there anything you personally did that helped you manage the stress, the challenges, the constant changes? Anything that you sort of found worked for you?
Personally, yeah, what worked for me personally was I reduced the negative news. Yeah. You see, when a news pops up on my system and it's so negative, I try to reduce the negative, and I try to look at the positive side of COVID. Yeah, that's what helped. You know, myself and two of my colleagues, we came together and we even wrote an article. We had an article published, okay, safer practices in restorative dentistry in the COVID pandemic. So what we did, we tried to document. I tried personally. I told myself I was tired of the negative news, but whether you like it or not, the negative news increases the level of anxiety. So I tried to remain positive, be a positive thinker, and then I found better ways of doing things without necessarily, I started enjoying shopping online without necessarily having to go to the malls. So things, I found easier ways of doing things than having a escape from the pandemic, because I tell you, there were so many psychosocial aspects of the pandemic which are not physically um, visible. And then people live in fear and you're so scared as if you are locked up inside the house. I'm a Christian. I started attending online services and I was enjoying it till now. I still do. You know, I go to church physically sometimes, but when I'm unable to, I go virtual. So you go check the internet, you always find, I'm a Catholic, you always find that there's a mass going on somewhere online. And then you join and I enjoy it. So I tell you, that's what I did personally. I was tired of the negative stories. So it was better to think positive. And then that helped. And I tell you something, I added a lot of weight in that period. Yeah, because physical activity reduced. So,
So you enjoyed some food as well, good
exactly.
food.
Right now, I love cooking, so you can imagine. So I was busy in the kitchen, trying out things. Yeah, my
Great, I love
God.
that. You're looking always at the positive. That's
Yeah,
brilliant. Yeah.
that's what I did.
And
And
it's true, when you talk about um, going online, it sort of opens the world in a way.
yeah,
So, if you want to attend a mass, I imagine you can attend one from all over the world through the Catholic Church. So yeah, that's a nice additional silver lining in a way to the pandemic. And obviously, yeah, minimizing the negative news. I'd love to get the article of your safer practices that you wrote with your colleagues. I think that would be really nice to
yeah.
link for
I'll
people
send
to
it to
read.
you via mail.
That'd be
Fantastic.
great. Yeah.
Yeah.
And I know that you wanted to talk a little bit about violence against health professionals.
Yes, in fact, I'll tell you. You see, in all my practice, I it's not been directed to me personally, okay, but I feel that interpersonal relationships are something every healthcare worker should be able to handle. Sometimes, like over here, when we have a lot of patients, and then the number of dentists, when you look at the dentist patient ratio is so high, so a lot of the dentists are under pressure. Sometimes you have 10 patients, 20 waiting, and maybe you have 4 or 5 dentists that can do that procedure. And then patients are tired of waiting, or something goes wrong in the course of providing treatment, you run out of consumables, and you try to explain to the patient, see, we don't have these, so we can't proceed to the next stage of treatment and all that. So you find some patients really flaring up. And over here, a lot of patients pay out of pocket. And once they pay out of pocket, they feel they've paid, they have entitlements and all that, so they are upset when there's any little hitch. They just expect, I have made payment, so I expect that everything should go well. And then they raise their voices. For me, it's not about physical violence. Sometimes emotional violence. Somebody is trying to solve a problem. You are shouting. There's tension. And before you know it, the whole place is in chaos. So I've had calls to intervene. I still remember one instance some years back. I came into the clinic. I also lecture. Apart from being a restorative dentist, I'm an associate professor of restorative dentistry. So I had finished teaching my students, and I came to the clinic, and I meet a chaotic scene, and I ask, "Oh, what's happening?" And patient goes, I will get boys to beat you up." And you're like, okay, okay. You try to calm everybody down. What's the problem? I always try personally to put myself in the client's shoes. If I were a client, that's where I always come from first. I don't jump and take sides immediately. I try to listen to the client, put myself in the client's shoes, and ask myself, how would I react? Is there a better way to express my grievances without being violent? And so I now try to calm the person down and tell them to, I understand where you're coming from. But remember, this is a public hospital. The doctor can only do what he or she can do within the available resources. It's not, if you are angry because of a person's attitude, I will understand. But if it's because of one thing or the other that's not available or readily available for treatment, then I would try to get you to understand. Yes, I know we humans, we are different, we react in different ways. And as a health professional, to always remember that everybody is not very same at every point in time. Some people may have been pissed off before they came to you, so it could be a misdirected aggression. So if you decide to react the way your client reacts, then you make a mess of the whole thing. So it's a lot of times these are people, if somebody doesn't have a problem, he has no business in the hospital. The hospital is not where people come to entertain themselves, it's not where people come to chit chat. Something broke them, and that's because they already had a challenge. So if we have that attitude, knowing that the hospital is not it's not a place you just sit, it's not a pub, it's not a bar. It's something brings you. Yes, and you don't know how much psychological trauma that health challenge has caused for that person before the person appeared. So a lot of times, health workers, no matter how stressed you are, you just have to be patient enough to understand where your clients and your patients are coming from. Sometimes it's patients' relations, they get upset, and then there's this attitude of, I'll tell you, I'm a consultant. I have resident doctors training under me. If I decide to see all the patients, then the training will not be effective. And sometimes you see patients get angry and say, no, it is the consultant I want. I don't want anybody. And you try to explain. I had a patient one time that told me, no, it's you I want. I said, if I sit on your case, I won't be able to review the other cases, make inputs, because this procedure may take me 2-3 hours. But if somebody else is doing it, I'm able to make inputs into other cases, so I can oversee 10 cases at the same time. And so you see people, their expectations, I just feel that sometimes their expectations when they come to the hospital, it's way over the moon. That's the truth. I don't blame them anyway. I don't. So I try to understand them. At the same time, I try to ensure that you also have to put the doctor, the healthcare worker in your own place. You were the one on the other side. That's what I tell people. Do unto others what you want others to do to you. Because even as a restorative dentist, I also have oral health problems. I see other people. I can't treat myself. I can't do procedures for myself. So, and funny enough is, if I have to go to see another doctor, if you don't know me personally, I don't start by introducing who I am to you. I want to be seen like every other client, every other patient. It is only when I now feel that no, this is not what I expect from a colleague, that's when I let you know that I'm actually a colleague, that I've decided to stay on the queue, I've decided to wait for my turn, because I also want to see what others suffer when they come to public hospitals. Because if you don't understand and appreciate where they are coming from. Private hospitals over here, things may be faster, smoother, but I tell you, public hospitals, the bureaucracy is not fun. I've been a patient myself in the public hospital. It's not fun. So sometimes I understand the patients could have long waiting hours, and that's one challenge. When you have long waiting hours, because somebody has come on time and then has to wait so long as if they have nothing else to do. I mean, because for me, we should be conscious of time. So it's that long waiting hours is actually a major challenge in public hospitals in Nigeria.
You put a lot in there, Dr. Joan. What I hear at the bottom of what you're saying is we need to see everyone, whether they're clients, patients, or the health professionals, as the human they are, and that
Yes.
everyone has their own challenges, everyone comes from a different place. And if we remember that, then we should be more gentle with each other, more patient, more generous with each other, to calm the tensions, to have a bit more patience, and hopefully not erupt in this sort of violent discussion and miscommunication.
Yes.
Did you have any other message that you wanted to give, either to health professionals directly related to what you've learned, or what a message that you'd like to pass on, or to the public?
Yeah, to both. Am
Okay.
I allowed? Yeah.
Yes.
To health professionals, I would say being a health professional, it's a privilege. And such privileges should not be abused. We must remember that we have a responsibility to our clients, to our friends, to our neighbors, to the public. And at every point in time, we must remember that and carry ourselves not as demigods, but as people who have this privilege to be able to bring smiles onto the faces of others. Like I said earlier, the hospital is not an entertainment center, it's not an opera, it's not a theater, it's where people who have problems come to. And so if you are privileged to be able to solve somebody's problem, to put a smile on somebody's face, then you should do it happily and not because you feel it's a burden. But sometimes you see people walking as though um, the client is a burden. But we should see it as a privilege, as an opportunity to do something good. And then to the public, I would say, please be patient. Try to understand the healthcare worker. In as much as you have a problem, I know you seek solution, but in seeking solutions to help problems, you should seek these solutions responsibly. Remember, the other person is a human, because if we all treat ourselves as the humans that we are, I believe the hospital will be a place where people go with problems and come out smiling. And then to the public, when you go in and you come out not meeting your expectations, some cases patients go in, well, for one reason or the other, the patient may lose a limb, some may pass on, and then you find out that relations, they just feel that, oh, it may have been the fault of the health worker that this thing happened. So if you go in and you don't get exactly what you expect, sometimes you just have to have an audit or a retrospection of what actually went wrong. Violence has never been the key to solving any problem. So if we have that at the back, otherwise every country will be at war. There are so many problems all over the world. In times past, countries went to war believing that they could solve the problems. But at the end of the day, you find out that after months, weeks, and years of war, the countries still have to sit and talk and have peace talks So that means that violence has never had a place in solving problems. So that's what I would say to the public. Always remember that we are all humans. Humans do err. And so we should please bear with healthcare professionals when they err one way or the other. We shouldn't lash out at them like it was intentional or it's their attitude. Some people believe that, oh, doctors are naturally proud, they're arrogant. I don't think so. I've been a doctor now for almost 20 years, and I've never seen myself as an arrogant fellow. So I find it difficult to associate that. Yeah, we may have one or two or a few that are, but I think generally speaking, um, I think some doctors are good.
Yes, I think most are. Thank you so much, Joe. Wonderful messages, both for health professionals and the public. And again, at the end of the day, we're all human. Let's treat each other with kindness and patience, and we will advance much more peacefully, and everyone will be happy. I love your message also to, that part of your job is to make other people smile. And that's quite funny when you talk about being a restorative dentist. It's sort of a play on words. So you're helping people with their actual smile, but you're also inside making them smile.
That's exactly what I do. That's the goal of restorative dentistry, is to improve people's smile. So I have a beautiful, smile. So a lot of times when I talk to my patients and I tell them, look, all I do is smile. When I smile, you'll be happy. That, I love your smile. I'll say, okay, yes, that's what I do. That's what I do. I make people smile, give you a better smile. So you have a lovely smile yourself.
Oh, thank you. You make it sound so easy, your work. I just make people smile. I imagine there's a lot more to it. I know there is.
I love my job. I love what I do. Yeah. So
well, that comes through for sure. We can see your love for your fellow colleagues and other health professionals, as well as for your clients and patients. That's really, really nice to see. Well, thank you so much for your time, Dr. Joan. Anything else that you wanted to transmit today?
Yeah, I just want to thank the organizers, for this opportunity. Really, when I was asked, I said, fine. I actually love what I do. So if it's to talk naturally, as long as it's not a scripted interview, I believe in saying things exactly the way they are. I'm a factual human being. Say things the way they really are, the way you feel. Yeah, so I'm open to that. Yes, because if you don't say things the way they are, we can move on. We can move on. We can progress. So I'm happy for this opportunity, and I tell you, I'm always available. And so I also write a lot of scientific papers. I love research, sincerely. I identify problems and then try to find out. If I can't find solutions to the problems, I should find out what's causing the problem. I should be able to identify the causative mechanism of the problem. So I love research. I have a lot of publications to my name. So even if it's not an interview, say, there's some concepts related to restorative care or even oral health care, and a team is required to do some work, some research work, I'm open and available.
Great, that's lovely to hear, and we can maybe put your contact details in the video as well, so people who are interested in talking to you further, engaging you in research, etc., can reach out to you. Okay. Great. Well, I'll let you get back to your patients, your clients today, and your staff. And thank you so much for taking the time, Dr. Joan, to speak with us today. It was really nice to hear from you and hear about your journey and your messages, both to health professionals and to the public.
Thank you so much, Helen.